Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving into a fascinating area of veterinary surgery concerning a condition known as short radius syndrome in dogs. Short radius syndrome arises from a disruption in the normal growth of the radius and ulna bones in a dog's leg. This leads to the radius being shorter than the ulna, often appearing as a step defect or step. The critical consequence of this is a loss of normal articulation between the radius and humerus, placing increased stress on the medial coronoid region of the ulna. These pressure changes can cause a variety of painful elbow pathologies. While the exact degree of shortening that causes clinical lameness is not fully known, treatment is generally recommended for defects greater than 2 to 3 millimeters to alleviate pain and lameness. Early intervention is highly advised to minimize the risk of associated pathologies. Traditional treatments like ulnar ostectomy for smaller defects or radial lengthening for larger ones have their own potential complications, including excessive callus formation, delayed bone healing, fusion of bones, limited elbow movement, and ongoing lameness. This brings us to a newer approach, acute arthroscopically assisted ulnar shortening. This procedure involves surgically removing a section of the ulna. Under direct visualization with an arthroscope, orthopedic wire is used to compress the bone fragments until optimal radiohumeral articulation is achieved. Crucially, this study surgeons added a plate for improved stability at the ulnar surgery site. The objective of this particular study was to describe the clinical findings, planning, surgical technique, complications, and short-term outcomes of this innovative procedure. The study examined 11 client-owned dogs that underwent acute arthroscopically assisted ulnar shortening between 2012 and 2021. At their initial presentation, the dogs typically showed a median lameness score of 2 out of 4. Preoperative radiographs revealed a median radio-ulnar distance of 4.5 millimeters, indicating significant incongruence. Osteoarthrosis was also present in 10 of the dogs. During the procedure, the median surgery time was 140 minutes, and the median time for the bone to heal was 8 weeks. Immediately after surgery, the radiographic measurements showed significant improvement, with the median radio-ulnar distance reducing to 1.3 millimeters. All dogs showed clinical improvement. The lameness score improved from a median of 2 to 1. The surgeons graded the short-term clinical outcome as full function in 4 cases and acceptable function in the remaining 7. Importantly, no major complications were reported. In discussing these promising results, all 11 dogs in the study demonstrated good bone healing and achieved either full or acceptable short-term outcomes. Follow-up beyond 2 years for a subset of 4 dogs indicated improved clinical function compared to their pre-surgical state and suggested no progression to severe elbow arthritis or chronic pain. Radiography was the primary diagnostic tool, and all dogs had short radius syndrome exceeding 2 millimeters, which is typically detectable with this method. However, the authors still recommend obtaining preoperative computed tomography when available for more detailed assessment. A significant advantage of acute arthroscopically assisted ulnar shortening is its ability to improve radiohumeral articulation with or without computed tomography data, making it a flexible option. While some dogs still had radiographic incongruence greater than 2 millimeters postoperatively, arthroscopic and clinical improvements were observed in all cases. This suggests that the changes achieved were sufficient for clinical betterment. The use of arthroscopy is considered the gold standard for intraoperative assessment of radio-ulnar congruency. It allows for direct visualization of the joint cartilage, enabling optimal adjustment of the limb. This dynamic assessment and the experience of the surgeons likely contributed to the accurate outcomes. Furthermore, arthroscopy allowed for the removal of fragmented medial coronoid processes, which may have also contributed to the observed clinical improvement. The study highlighted that the method of using an orthopedic wire to adjust the articulation, followed by rigid internal fixation with a plate, might reduce postoperative complications compared to older techniques that used pins. Despite the positive findings, the authors acknowledge limitations of the study, including its retrospective nature, small sample size, and varying postoperative care across multiple institutions. They emphasize that while the study met its goals of describing the planning, execution, and short-term outcomes of acute arthroscopically assisted ulnar shortening, more robust, prospective, randomized, and controlled studies are needed to provide stronger evidence. Nonetheless, based on the current results, acute arthroscopically assisted ulnar shortening could be considered a viable treatment for short radius syndrome with radio-ulnar steps up to 9 millimeters. Future research is necessary to investigate its effectiveness for larger defects and potentially in combination with other procedures. Thank you for listening to the Veterinary Medicine Digest. The title for the reference paper is in the video description. Remember to test your knowledge by answering the questions below, and as always, keep those minds inspired, hearts light, and tails wagging.